Chelation therapy is a treatment given intravenously under the supervision of a thoroughly trained and licensed medical doctor. Just prior to the treatment session, a registered nurse prepares the intravenous solutions. The ingredients in each patient's intravenous container are introduced in a sterile fashion using all disposable supplies. The dosage of the ingredients are individualized for each patient according to the patient's height, weight, age, sex, and kidney function blood test. Once the patient arrives to the clinic, a tiny intravenous needle is placed in the hand or arm. The patient is then escorted to a comfortable recliner chair where they relax while the solution is slowly administered over the following 2.5 to 3 hours to ensure that the solution is dripped into the vein at a carefully prescribed rate. All of these exacting procedures are used to ensure that the treatment is given with the utmost of safety. The chelation solution contains several important ingredients: EDTA, magnesium, vitamin C, and B vitamins. Each ingredient is important, and each plays a role in the effectiveness of the chelation treatment. EDTA, or ethylene diamine tetraacetic acid, is a synthetic amino acid which has been used for over 40 years. When dripped into the bloodstream as an intravenous treatment, it circulates throughout the body like a non-toxic detergent, cleansing away calcium deposits in hardened arteries, as well as toxic metals and accumulated iron in tissues and organs. Once EDTA has captured the calcium or metallic waste, it circulates throughout the bloodstream until it exits the body through the kidneys. The other ingredients, magnesium, vitamin C, and B vitamins, are all used to increase the cleansing properties of EDTA, thus making the treatment more effective. Chelation therapy is known to work through well-understood scientific principles. In fact, this treatment helps to address some of the basic reasons why we develop chronic illnesses later in life. One of the most important medical breakthroughs of this century was the discovery that most diseases related to the aging process are caused largely by an overabundance of toxic substances known as free radicals. Here is a common example of free radical damage. A fresh apple is cut open and exposed to the air. In a few minutes, the apple turns brown from free radical damage. Damage caused by free radicals requires oxygen and is known as oxidation. Because our bloodstream is full of oxygen, free radical damage takes place very readily through the process of oxidation. Free radicals are molecules which have undergone changes making them highly unstable. This cartoon illustrates a stable molecule. The two wheels on this cartoon molecule represent electrons spinning around the outermost part of the molecule. A molecule with all of its electrons in pairs is stable. However, if the molecule loses an electron, it becomes unstable. This molecule is now a free radical. It is so unstable that it will spin around until it collides with some other molecule, causing damage in the process.
A free radical is a cellular killer, destroying cells outright.
Three things are necessary to make a free radical: a stable molecule, oxygen, which loves to steal electrons from stable molecules, and a metal or calcium atom. When oxygen approaches a molecule, it tries to steal the molecule's electron. This does not happen readily if oxygen is all by itself. However, if an electron-conducting metal or calcium atom is nearby, the metal or calcium will act as a catalyst to strip off the electron from the stable molecule. Now, the oxygen is an unstable free radical with an extra electron, and the molecule has also become an unstable free radical.